Awesome. I want to congratulate both of you and the team on incredible progress over the last couple of years. It's been tremendous to be a very small part of your journey. Very proud of what you're building, and excited for what's coming next. Do you also want to share some of the grants and awards that you've won recently?
So we were very grateful to have support from so many organizations, but just some of the ones that were really instrumental in our past 2 years were we received a major grant from the American Heart Association in December of 2019, literally kind of on the cusp of the shift that we were making. We were able to communicate how we were working a problem that they want to be a partner in solving and addressing, the explosion in chronic disease, especially amongst groups that have the fewest resources themselves to handle it. We've received support from the Massachusetts Health Policy Commission, which is a quasi-government group that looks at value-based care and outcomes for the state of Massachusetts, and is really one of the organizers for a lot of the partnerships that are looking to not just address acute care needs for patients in the state, but how to make everyone healthier so that they don't need to show up in the emergency room. Our ability to communicate not just what the vision is, but how we're trying to, even with the few resources that we're able to bring to bear, bring forward new insights from our community connections, has been fundamentally the most important traction that we've been able to show, not just to investors, grant writers, groups like BonBillo, Mass Challenge.
So what that looks like for us going forward is really looking to partner with insurance payers, ACOs, and other value-based care orgs who recognize the simplicity and efficacy of food as medicine and want to partner with EatWell, partner with community health centers to prescribe our medically tailored meal kits